My name is Jacob Katko. This is my kinesiology presentation. Starting off with basic terminology in kinesiology and planes and axis of rotation. Physical activity is any bodily movement produced by the contraction of skeletal muscles. Exercise is a type of physical activity that is planned, structured, and allows for repetitive movements. The major systems in the human body are the cardiovascular, respiratory, musculoskeletal, nervous, and endocrine systems. Now focusing on planes and axis of rotation. Planes are reference points of the human body to determine any specific movement patterns. Axis consists of the angle at which movement in a plane can become best observed on a plane. The planes presented are transverse, sagittal, and frontal. Here's the overview of joint movements. Movements that occur in the sagittal plane, as previously stated, consist of flexion and extension. Movements that occur in the frontal plane consist of adduction and abduction. Movements that occur in the transverse plane are horizontal adduction and horizontal abduction. As pictured below, abduction is away from the midline of the body, as seen as the arms are raising to a T-shaped position. Adduction is towards the midline of the body as it goes from a T-shaped position to a just normal standing position. It's now focusing on the skeletal system. The functions of the skeletal system are support, protection, to assist movement, mineral storage, red blood cell protection, and lipid storage. The skeletal system consists of the axial and appendicular. The axial skeleton consists of 80 bones. The appendicular skeleton consists of 126 bones. The skeletal system is also made up of different classifications of bones, such as long bones, short bones, irregular bones, flat bones, and sesamoid bones. The articular system. The articular system is the degree to which a joint can move and is dictated by the type of joint. Examples of types of synovial joints include plane, saddle, ellipsoidal, hinge, ball and socket, pivot joints, and bicondylar. Joint classifications consist of synarthrosis, um, amphiarthrotic, and diarthrotic, which are synovial free movement, um, and amphiarthrotic or cartilaginous and moderate movement, and synarthrosis is fibrosis and immovable. So now focusing on upper, lower, cervical and lumbar spine, or upper body movements and lower body movements. Upper body movements include the shoulder, wrist, elbow, and scapulas. The shoulder mainly consists of synovial and ball and socket joints, including flexion and extension, abduction and adduction, and internal and external rotation. The wrist and elbow consist of only two movements, which are flexion and extension, while the scapular thoracic joint has six movements, which include elevation, depression, upward rotation, downward rotation, protraction, and retraction. Now looking at the spine movements, these include cervical and lumbar flexion and extension, lateral flexion and extension, and cervical and lumbar rotation. Lower body structures and movements include the ankle, knee, foot, and foot, which have six different movements. which include flexion, extension for the knee, dorsine and plantar flexion for the ankle, and inversion and eversion for the subtalar, which is the foot. Joint movement and range of motion. The kinetic chain is the system of muscle joints and connective tissue that work together to produce specific movements. Closed pack position is when there's both maximal congruency of the joint surfaces. Open pack position is when there is at least a joint congruency in the joint capsule and legs. Hypermobile is joints with excessive movement, while hypomobile is joints with restricted movement. The abbreviation ROM means range of motion. Range of motion is the joint's ability to move in a specific direction, often measuring flexibility and functionality of a joint. Examples of range of motion would be like shoulder rotations, circumduction, for example, um, or anything that just kind of tests flexibility. So open and closed kinetic chain exercises. So open chain exercises include bench press and single leg squats as given below. Closed chain exercises include barbell back squat and close grip push-ups. Now looking at the muscular system, uh, there are three types of muscle tissue, which include skeletal, cardiac, and smooth. There are more than 600 skeletal muscles in the human body, which are approximately 100, which are primary movement muscles. The primary role of tendons is to attach muscle and bone, and the primary role of ligaments is to attach bone to bone. Now on the left, synergist prevents any unwanted movement. Co-contraction is simultaneous contraction of the agonist in the antagonist. Agonist, when a muscle or group of muscles is responsible for an action or movement. Antagonist is relaxing the muscle to permit the primary movement. It acts as a brake at the completion of the movement. And then lastly, insertion distal, which is distal muscle attachment, and typically moves more. Now at the bottom right, classifications of muscles include pennate, quadrate, fusiform, fan-shaped or triangular, and longitudinal. So bony structures and articulations of the shoulder. The bony structures of the shoulder are the clavicle, scapula, and humerus. The articulations of the shoulder are the glenohumeral joint, acromioclavicular joint, sternoclavicular joint, and scapular-thoracic joint. Also important to note is the glenoid labrum, which is composed fibrocartilage of the scapula, which deepens the fossa and cushions against impact of the humeral head in forceful movements. Now, pictured to the right is an example of bones of the shoulder. See the clavicle on the top, the sternoclavicular joint right underneath, glenoid cavity, and the glenohumeral joints, which are part of the shoulder rotation. The labrum, which is very necessary for good shoulder flexibility. The scapula, the humerus, which are all pretty essential to the way our arms and shoulders function. So now looking at the anatomy of shoulder stability. Shoulder is composed of four rotator cuff muscles: supraspinatus, infraspinatus, teres minor, uh, subscapularis. Rotator cuff function is important for maintaining the integrity of the humerus. And the acronym SITS refers to all four rotator cuff muscles. Muscles involved in exercises include any abduction and adduction movements involving the deltoid and supraspinatus. Adduction muscles include the latissimus dorsi, teres major, and pectoralis major. Strength exercises revolving around abduction include any dumbbell lateral raises, as well as wide grip overhead press. While adduction would be something like a lat pull down and straight arm side pull down. So lastly, bony structures and articulations of the elbow, wrist, and hand. So bony structures of the elbow would include the humerus, ulna, and radius, and this would also apply to the wrist and hand as well. As seen below, see the ulna, the radius, and the humerus for the elbow, and as pictured below. And for the hand and wrist, the radius at the top, the ulna, and um, the hand muscle or hand bony structures as well.